Welcome to the Health Daily Show. I'm your host, Chitra Nabat. Joining us today is Arpa Garay, Chief Commercial Officer of Moderna, otherwise known as the Beyonce of biopharma. Arpa, welcome.
Thank you, Chitra, and thank you for this new nickname that I've never heard before. It's good to be with you.
Arpa, a lot of folks know Moderna as the company that created the COVID vaccine. What is Moderna, and how are you different than other biopharmaceutical companies?
Yeah, so I've recently joined Moderna as Chief Commercial Officer, and I can tell you we are much bigger than a COVID vaccine company. I see COVID as our first proof of concept of the technology that Moderna has been working on over the last 12 years, where we've really built expertise in the platform of mRNA, and we're looking to see how we can really blow out the pipeline and change science and create a new class of medicines for the future.
Tell us more about mRNA and the clinical areas that you're getting into, how it all works.
Sure. So we've recently discussed in our R&D day just a pretty broad pipeline where we can see potential activity across not just prevention with vaccines, but also in treatment. So we're looking at the flu vaccine, we're looking at an RSV vaccine, so a broad respiratory portfolio, including combinations. We're also looking at latent vaccines, so things like CMV, for example, where we're in phase 3, that could really help potentially prevent birth defects, the number one cause of birth defects in the world. We're also looking at rare diseases. So we have some encouraging early data in some cardiometabolic rare diseases. And then last but not least, we're also looking at cancer. So really excited about a partnership that we recently announced with Merck to look at how we can work together in the oncology space. So this COVID vaccine program has really expanded quite a bit into all sorts of different areas, from prevention all the way to treatment.
Well, and to the point where you've got 700 scientists, about $20 billion to invest in R&D. How does that position you in terms of being different, unique in terms of your business and operating model compared to your competitors?
Yeah. So it's a privileged position to be in because we can really prioritize the platform, we can prioritize the science, and we can really invest in our own science, right? We can use that cash to invest R&D where we see a signal, we go all in. And really helps us to accelerate our pipeline, where we now have 45 different candidates that we're studying across 48 different programs. So a very different position than most biopharma companies are in.
Where do you think you will focus on in terms of being sort of the next category changer?
So the category changer, we're here to be the leaders in mRNA technology. Those first 4 areas, I think, are just the first 4. We'll continue to look at where can mRNA really disrupt the industry and create change for patients around the world.
What are some of the challenges you're facing? Because in the last year, I think the stock is down around 60%. So what are some of those challenges and how are you solving it?
Yeah. So we are at a very interesting pivot point for the company. We are going from a pandemic phase company where around the world we were contracting with governments. The world needed COVID vaccines, the world needed Moderna, and it was really a Moderna and a government contracting play. As I look into next year and beyond, we're going to be facing a more competitive, fragmented model where we're becoming more of a commercial company, and we're going to have to secure the business for our first COVID vaccine, but then also think about how we're going to build a broader company and organization for future products as well.
Well, that's why they hired you, because you're the first commercial leader in the company's 12-year history. How will you build this commercial organization domestically and internationally in a different way than others?
Yeah. So I'll say the benefit is we're building. So I don't have to worry about legacy systems or people or assumptions on how to commercialize products. This really is a white space for us to figure out how are we going to build a company that is different, but really can meet consumers and patients where they are and bring an experience that really helps to improve patient outcomes. So really we're starting from scratch, removing preconceived sort of biases from the industry and trying to see how we can approach this in a very different way that's data-driven, digitally enabled, and very consumer focused.
On the data side, the digitally enabled side, You've been in this industry a very long time, many years at Merck, so you've seen the pain of getting market adoption at scale for new drug therapies. You talked about having 45 new clinical areas that you all are pushing into.
Yeah.
Talk about getting to mass market adoption at scale.
Yeah. So I'll say really it's starting with this notion of how do we meet our customers where they are? And if that means we have to partner with other companies on the private sector or other public health entities, we are very open to looking at it in a very different way. So I think for us, partnerships are really, really important so that we can get to as many people as that need our medicines and our drugs.
Arpa, let's shift to leadership. In life, in business, there are rules, codes, norms to how things are done.
Yeah.
Where have you been a code breaker in your career, life journey? How did you do it?
So I'll say for me is probably two things. One is to always take risks and do things that I have not done before. So if I think about growing up, I lived in different countries, I was put in different school systems. If I look at my career, I took on a lot of different roles domestically, globally, internationally, across a lot of different business challenges. Because with every new experience or risk that I took, I grew that much more and developed that much more. I'll say the second thing is just this fundamental sort of belief that I have, and to steal a quote from Thomas Edison, I might get it wrong, there's always a better way to do something, so find it. So I always approach every new job that I have with trying to have a blank sheet of paper to say, okay, if there's a better way to do this, how do we design it from scratch with patients at the center of everything that we do?
Arpa, thank you so much for joining us.
Thank you.